Hey guys, Professor Keith here. Wanted to show you one of my favorite things about my house, and that is my tree in my backyard. I have to say, sitting out here, I just find it really therapeutic. Now, that's a word a lot of people use. They describe things as being therapeutic or being like therapy, right? It could be mowing the grass, it could be going shopping, it could be drawing pictures in your spare time. It seems like, especially if you look at like the self-help section of a bookstore or Amazon or something like that, like there are a lot of different kinds of therapy. Definitely a lot more kinds of therapy than your book seems to tell you about. And in reality, there are as many different kinds of therapy as there are people trying to sell you solutions to problems you didn't even know you had. But if we look at the kinds of therapy that are supported, accepted by the field of psychology, the kinds of therapy that are empirically supported, we can see that the history of psychology is represented by three main movements, or waves, in how we approach psychology and treating mental illnesses. The first wave of treatments were the ones represented by psychodynamics and humanism. These were what your book calls insight-oriented therapies. Their goal was to gain insight into your problems. Guys like Sigmund Freud thought that if he could help you understand the source of the conflict deep in your subconscious, the id that wanted sex and aggression, and the superego that wanted you to be socially acceptable, that you could move past the psychic blockages that were there, and that this would make you better. Guys like Abraham Maslow and Carl Rogers, on the other hand, thought that your mental illnesses, and they wouldn't have called them these, but that your mental problems were a result of how the world made you feel, that you wanted to be a really good person, but that the world just got in your way. Both of these are focused on gaining insight in your problems and hoping that just understanding your problems leads to their solution. And you can imagine that overall, their success rate is about what you would imagine them to be. Not really great. I mean, after all, most of Sigmund Freud's patients, most patients who see people who are either psychodynamic or humanistic in nature, end up seeing these therapists for decades, if not their entire lives. And you kind of have to ask yourself, if you've been going to a doctor for decades for a problem you didn't know you had, how much of a solution are you really getting there? This kind of a realization led to the development of the second wave of treatments in the field of psychology that emerged toward the middle of the 20th century. Spearheaded by guys like B.F. Skinner and John Watson, you should remember those names, behaviorists, this gave rise to a new kind of therapy, behavioral therapies. Behavioral therapies and those that came after, called cognitive behavioral therapies, both belong to action-oriented therapies. As you can imagine, the goal of action-oriented therapies isn't to gain insight into your problems, but rather take action into fixing them. If you asked a behaviorist, well, what's the source of a problem? Their best response might be, well, who cares, as long as we can fix it. Now, a behaviorist goal, now you guys are going to be taking an exam on learning conditioning. These are the same principles that fueled behaviorist treatments when it came to this kind of a therapeutic approach. The goal was to look at your problematic behaviors, to measure exactly how bad they were, and then implement some sort of a behavioral change focused on conditioning or behaviorist principles. And if you observed some sort of improvement, that's really great news. But if you didn't observe an improvement, something needed to change. One of the big advantages of a behaviorist approach this way is it's focused on data. It's focused on getting better. It's focused on, even if you get a diagnosis for some sort of mental illness, not accepting that that diagnosis is a part of who you are, but instead saying that it's something that needs to be fixed, and it doesn't need to take your whole life to do that. We're talking like 6 to 12 weeks to get you the mental tools that you need to do better. And overall, behaviorist treatments have shown to be really, really effective. Especially in people with behavioral disorders like ADD and ADHD. You help children to become aware of their problematic behaviors and teach them how to control them. Flooding and systematic desensitization therapies are really good for treating specific phobias. Systematic desensitization involves taking something someone is afraid of, like heights, and exposing them to more and more intense versions of this thing they're afraid of. So, for example, if you're afraid of heights, you probably wouldn't be up here in this tree with me. And what we would do is we'd sit down in a therapist's office and we would talk about heights and high places and what some high places are. And then I might show you pictures of tall things, the Grand Canyon, the Eiffel Tower, the Sears Tower, really big places, or pictures taken looking out these windows. Next, we might watch a video of somebody going up to a really high place or doing rock wall climbing. And then little by little, we would expose you to heights, climbing up on a step ladder, climbing up on a really high ladder, until eventually we get to the point where we face your fear directly, doing something really incredible, like jumping out of an airplane, slowly getting you to the place where you do that thing you were terrified of and realize that you're not going to die from it. This can be used to treat lots of different kinds of phobias, and systematic desensitization is really, really effective. Not only is it really effective, but it's effective over the course of 1 or 2 treatment sessions, not a whole lot. Even more effective than systematic desensitization is a flooding therapy. Now, most people really don't want to do this sort of thing, but it's the opposite of systematic desensitization. It involves taking that thing that the person's afraid of and giving to them all at once. I asked you to come on over for a therapy session. You're afraid of heights. We sit down in the office. I said I'm going to put a blindfold on you and take you to some really exciting place. We put you in the car, take you to the airport, go up in the air, and I push you out the door with a parachute on. Now, it might not be exactly that crazy, but the point here is to make you face your fear immediately and realize in the course of facing that fear and not having the option to run away that you're not going to die. You may never love heights or snakes or spiders or clowns, whatever your phobia is. But you will get to the point that you can live your everyday life without it being some sort of a problem. And that's really the goal with behaviorist therapeutic approaches, is to get you away from the behaviors that you've accidentally reinforced that can be problems. Even more effective, and the real representation of the second wave of therapeutics, is cognitive behavioral therapy. Cognitive behavioral therapy takes behaviorist principles and applies them to cognition, or thinking. In other words, it looks at your thoughts as if they were behaviors, just behaviors we can't examine, and tries to replace bad ones with good ones. Examples include rational emotive behavioral therapy, REBT, that focuses on how people perceive the world differently. That you and a friend of yours may get equivalent grades on an exam, and you assume that this grade, maybe it's a B-, is a really, really awful grade, whereas your friend thinks it's really great. I mean, after all, they hardly studied. Now, realistically, your friend could probably stand to study a little bit more, and maybe there are things that we could work on to help you do even better on future exams. But the big problem a therapist would say is that the way you view the world is making you anxious, and what they can do is help untrain that automatic mental habit we go to of feeling really bad when something like that happens. Cognitive behavioral therapy, I mean, most of us don't realize it, but we have mental habits, all kinds of mental habits, and cognitive behavioral therapy can be helpful in treating those too. People with negative body images, people who suffer from depression, who suffer from anxiety. Pay attention the next time you get a grade back on a test. Pay attention the next time you're reminded of a test. Where do you go automatically? Do you think it's no big deal, or do you think it's going to be the end of the world? The next time you walk past a mirror, pay attention to what you think. Do you say, oh man, you know, I'm looking pretty good? Or do you say, you know, I really need to hit the gym. Oh, I really wish I looked nicer. I wish my nose were different. I wish my hair were different. I wish my eyes were different. If you're the kind of person who automatically goes to this negative place, you might not realize it, but that's something that can be retrained. Cognitive behavioral therapy is currently the most effective therapy out there, and for a lot of conditions, including attention deficit hyperactivity disorder, a lot of anxiety disorders, mood disorders, even psychotic disorders like schizophrenia, CBT is more effective than medication. Get that, more effective than psychopharmaceuticals, antidepressants, anxiolytics, or medications that we take for a lot of things is a simple behavioral retraining. Most people don't realize this, but it is really, really effective. There can be problems, though, with CBT, and one of the problems emerges from the fact that you get really, really focused on the things that are causing you problems. For example, if you want to observe improvement, you have to know exactly how often you're getting stressed out and almost having panic attacks, so you can get out in front of those panic attacks and observe whether or not the thing that you're doing, that the intervention you're trying to put in place, is effective. The problem with that, though, is that, well, what causes panic attacks, for example, is really fear about future panic attacks. More often than not, it's not the situation itself, but the concern about the panic attack that causes it to happen. And as you might imagine, this can make panic attacks worse in patients who are trying to use CBT. And this is where the third big wave in psychological treatments is starting to emerge right now. In fact, right now is a really exciting time in the field of psychology because we're seeing this new emerging wave in therapeutics. The new wave that we're seeing is something that a lot of people are dismissive of really quickly. I myself was dismissive of it just because of the name of it. And this is mindfulness therapy. Mindfulness therapy emerges out of the Buddhist, the Eastern tradition of mindfulness meditation. The idea of mindfulness meditation being to not clear your mind of everything, not to have a transcendent experience, but to find a way to accept the world that is around you, to allow thoughts to float by you, to be able to examine them, but without getting stuck on them. To maybe not clear your mind entirely, but to find a way to focus on one specific thing and not allow all sorts of other distractions to get in your way. You can imagine most of us spend our lives with our thoughts and our emotions sitting right here in front of our faces, and there's nothing you can do about it. I mean, think about how often you get angry or you get sad or you get irritated and it feels like you had no choice. Now, mindfulness meditation isn't about never feeling anxious or unhappy or sad ever again, but becoming aware of the fact that you can control these thoughts, these feelings, and these behaviors, that you can be aware of them, you can allow them to happen, but they don't have to consume the way you feel. In a way, mindfulness therapy is built on mindfulness meditation and practicing it, building up your mental muscles, as it were, practicing sitting and focusing on one specific thought. And then when you get distracted, not being upset about it, but allowing yourself to recognize that you've been distracted from what you were supposed to be thinking about, something like just breathing in and out. And when you get distracted, finding a way to bring yourself back to what it is you're supposed to be focused on. In this way, you can strengthen those mental muscles. So if you're functioning in your everyday life and something starts to make you anxious or angry or unhappy, you don't have to fight back against it the way CBT would have you do. In fact, fighting back the way something like cognitive behavioral therapy might have you do might strengthen your anxiety or your frustration or your sadness. Instead, you learn to recognize that it's there, allow it to be there, and then allow yourself to function without this thing taking over your life. It's something that's really new. It's something that's just now starting to catch on in the scientific community, and we're seeing it having an appeal in much the same way that things like acupressure and acupuncture had an appeal. That we're starting to see that these things are effective, maybe not for the reasons that spiritualists originally thought they were effective, but that they are effective nonetheless, and that for a lot of conditions, especially anxiety and mood disorders, mindfulness therapy seems to potentially be even more effective than cognitive behavioral therapy or even behavioral therapy. So, this is just a little bit of an overview of some of the most effective kinds of therapeutics that we've seen in the field of psychology and some real defining movements in the field of psychology. In the meantime, if you're not making use of some specific therapy, of course, you can always feel free to find your special happy place like my oak tree in my backyard and experience a little bit of therapy on your own. Of course, make sure to take time to relax, de-stress, eat right, and focus before your exam this week and next week. Good luck on exam 3 and on the final exam. If you have questions between now and then, just let me know.